Okay, our next modality is ultrasound. So ultrasound falls under our heat category because what it is, it uses high frequency sound waves to deliver heat in a mechanical way to the body. So what it does is it increases circulation to promote healing. We're going to raise the tissue temperature 7 to 8 degrees, and this is cool because we can go about 2 inches below the skin's surface, but we're not going to really feel much on the skin's temperature, so we can actually get a deeper heat deeper in the body. So there's two types. There's pulsed, which is a non-thermal effect, so it kind of goes on, then goes off, goes on, goes off. And what it'll do is the flow of sound waves are interrupted, thus less energy is produced. So if we have some wound healing we want to do, if we have to go over some bony areas, some subacute injuries, we can do that. Mainly we use continuous, so we get that thermal effects. We get the sound waves are always going, increase in circulation. So we can get some non-thermal effects, at a low intensity for acute injuries. But you kind of just gotta know what setting to use. But mostly we use it for continuous. So when do we want to use ultrasound? So post-acute soft tissue injuries. So again, if we're out of that phase one, we want to use that. If we have any bursitis, remember that's our bursas, those fluid-filled sacs. If they're inflamed, we can use it. Perfect for tendonitis. So our knees, that patellar tendon, perfect for that. Fasciitis, that bottom fascia layer of your foot. Okay, when we don't want to use ultrasound is if we have inflammatory conditions. So if we're using heat and we add heat to it, remember it's going to make it worse. If we have areas of limited vascularity or sensation, so you don't get a lot of blood flow or anything. Never want to go over eyes, ears, heart, reproductive organs, endocrine glands, central nervous system, or growth plates. So stay clear of those. Okay. So there must be a coupling medium. What that means is there has to be some sort of gel. Ultrasound only works with a gel that's applied to it. So it cannot travel through the air and then it is reflected by the skin. So you have to have something to go through. So lotions, gel, some type of water applied to the skin will help drive that through the skin. We have what we call a transducer with a sound head, and it has to move at all times. It can actually hurt somebody if it's not moving. Okay, small circles or just up and downs, 1 to 2 seconds there. Okay, it's about 5 minutes, and you only can go 3 to 4 times the size of the sound head. So if you look at that picture there, you can only do a small area. We can't do like a whole hamstring or anything. Intensity is determined by the stage of injury and the depth that we want. If it's something superficial, then we'll do a less intensity. If we want something deeper, we have to do a higher intensity. Now, there is a thing called phonophoresis. So this is a method where we can drive certain molecules through the skin. So if we wanted to put like some sort of ointment or a medication on, we can actually drive it to that injured tissue. So hydrocortisone and anesthesics are used pretty well with this. That'll deliver that drug or that medication into the skin. So what we do is we massage the medication in the skin, then we put the ultrasound gel on, then we do ultrasound to deliver those molecules into the skin. We do a lower intensity if we want a longer duration for that. What we can use it for is tendinitis, bursitis, and different trigger points within our muscles. We also have what we call iontophoresis, which is the process of chemical ions are transported through the skin by an electrical current. So we can actually use this with our e-stim. So again, same medications like hydrocortisone or salicitates. We do about 10 to 20 minutes once a day, which will help deliver those molecules through the skin.